Confirming the signs of dementia. 1. Familiarize yourself with some types of dementia. Dementia is a widely varying condition, and it will look different from patient to patient. In large part, you will be able to predict how the patient will progress by taking the cause of the dementia into consideration. A. Alzheimer's disease. Dementia progresses gradually, usually over the course of years. The exact cause is unknown, but plaques and structures called neurofibrillary tangles have been found in the brains of Alzheimer's patients. B. Lewy body dementia. Protein deposits, called Lewy bodies, develop in nerve cells of the brain and cause a decline in thinking, memory, and motor control abilities. Hallucinations may also occur, and lead unusual behavior like talking to someone who isn't there. This may be related to Parkinson's disease. Dementia of Parkinson's usually begins 5 to 8 years after the onset of Parkinson's symptoms. C. Multi-infarct dementia. Dementia occurs when a patient suffers many strokes that block a brain artery. People suffering from this type of dementia may have symptoms that stay the same for a while and then get worse as they have additional strokes. D. Frontotemporal dementia. Portions of the frontal and temporal lobes of the brain shrink, causing personality changes or the ability to use language. This type of dementia tends to occur between the ages of 40 and 75. E. Normal pressure hydrocephalus. A buildup of fluid puts pressure on the brain, causing dementia that comes gradually or abruptly, depending on how fast the pressure increases. A CT or MRI will show evidence of this type of dementia. F. Creutzfeldt-Jakob disease. This is a rare and fatal brain disorder believed to be caused by an unusual organism called a prion. Though it may be present for a long time before symptoms emerge, the condition comes on very suddenly. A biopsy of the brain will reveal prion proteins believed to be cause of the condition. 2. Take the person to a doctor. If you think you see a constellation of behavioral changes and symptoms, you need expert evaluation. One or more of these tests is essential for evaluating a person with dementia. A CT or MRI can show whether or not the person might have had a stroke or if there is any bleeding or a tumor in the brain. B. A PET scan can help a physician to determine if depression or other mental health problems may be contributing to the dementia. 5. Inform the doctor about all medications the person is taking. Certain combinations of drugs may mimic or add to the symptoms of dementia. Sometimes, the mixing of unrelated drugs used to treat different diseases causes dementia-like symptoms. This type of drug mixing is common with older people, so make sure you have an accurate medication listing. A. Some classes of common medications that can cause issues are benzodiazepines, beta blockers, selective serotonin reuptake inhibitors, neuroleptics, and diphenhydramine, among others. 6. Be prepared for a full physical examination. A physical exam might identify a disorder that overlaps with or contributes to dementia. It may rule out dementia entirely. 2. Examples of related conditions include heart disease, stroke, nutritional deficiency, or kidney failure. Variations in each of these factors may give a clue to the type of dementia that needs to be treated. A. The doctor may also conduct a psychiatric evaluation to rule out depression as an underlying cause of a patient's symptoms. 7. Allow the doctor to evaluate cognitive abilities. This might include tests for memory, math, and language skills, including the ability to write, draw, name objects, and follow directions. These tests assess both cognition and motor skills. This is something that a healthcare professional can check for using the Montreal Cognitive Assessment. The St. Louis University Mental Status, SLUMS, test is another option. 8. Submit to a neurological evaluation. This evaluation will cover balance, reflexes, sensory and other functions in the patient. This is done to rule out other disorders and identify treatable symptoms. The doctor may also order a brain scan to identify underlying causes like strokes or tumors. The main forms of imaging used are MRIs and CT scans. 9. Find out whether or not the dementia is reversible. The dementia that arises from certain causes can sometimes be treated and reversed with medical care. Others, however, are progressive and irreversible. It's important to know which category the patient falls into, so you can plan for the future. A. Potentially reversible causes of dementia include hypothyroidism, neurosyphilis, vitamin B12/folate deficiency/thiamine deficiency, depression, and subdural hematoma. B. Irreversible causes of dementia include Alzheimer's disease, multi-infarct dementia, and HIV dementia.